Hey, how's it going? My name is Jover. I've been a long-time chronic sufferer of atopic dermatitis, otherwise known as eczema. I don't know if you can look closely, but I do have a huge flare-up right now. It's something that I've had all my life since I was a baby, and I am now a 47-year-old man that still deals with this. Right now, I am not on any topical steroids, so I'm going through a serious withdrawal. Topical steroids being cortisones and creams. I've tried everything under the sun for the past 47 years, including being boiled with herbs and in a pot when I was a child to relieve any of these symptoms. I've had all the symptoms of having atopic dermatitis, including rashes, itchiness, pain, swelling, inflammation, bleeding, oozing of, it sounds real gross, but like oozing of the wounds. Also have suffered the psychological effects of having atopic dermatitis from being teased as a kid, from being ostracized by children because they didn't understand that I was just going through, the symptoms of having eczema and atopic dermatitis. Some of the psychological things, irritability, I guess, long-standing trauma when it comes to this kind of stuff. I guess some of it also is, when you're younger, you have serious doubts about yourself and what you're capable of and what you're about, because it's hard because people don't accept you fully for who you are because of, how you perceive your people look at you. Even today, I hide my blemishes through lots of moisturizer, lots of creams, growing a beard, all of that to hide the fact that I am suffering. Anyway, if you look real close, you could see my nose is peeling, the areas around my eyes are peeling, my forehead is peeling and it has like wounds and stuff. I do have a new treatment called a biologic that is not experimental, but is kind of new to the market. Duplicent is something that's been offered on the market for a while, and now there's a new company called Lilly that makes a medication called Ebglyss. I know it's hard to say, but it's Ebglyss. I'll provide the link at the bottom here. But today is day 0. I haven't ever used this medication. I am very optimistic that it'll be a quote-unquote cure, and I hope it's life-changing. I hope from here, some of the inflammation and the itchiness and, the problems they have with atopic dermatitis gets better. And I hope that what I'm doing here to document my progress helps others, in that they can see the before and after or understand some of the symptoms, if there's any symptoms that I might have along the way, and also like my experience. Like, again, I've been living with this for 47 years. It's affected my quality of life having atopic dermatitis. People, like, you saw me scratch my head. That's part of like what people perceive to be part of my personality. But it's not actually part of my personality. It's just that I'm constantly itchy. And I hope that people will understand this journey to be a documentation of what it is to be dealing with this kind of stuff. Anyway, we're going to go with the unboxing of the medication. I've never done this before, so we'll see how it goes. Cool. Oh yeah, some background. I'm going to show a few pictures. I guess, right now we're going to have the overlay of me talking. A couple of pictures of some close-ups of some of the symptoms I'm going through. Obviously, I don't feel confident about showing my complete body. As you can see, upon close-up, my skin has lots of blemishes, a lot of scar tissue, a lot of scabbing. This is my usual when I wake up in the morning. If I wake up in the morning, I will try to take a shower in order to wash off and feel more comfortable. If I don't do that, then I end up being very, very irritated for the rest of the day. So the way that I got this medication is through a visit to my dermatologist. Shout out to Anthony Mack, Dr. Anthony Mack. He saw that I was a long-term sufferer, wanted to help me. He said, I'm going to try to get you on this trial with Lilly, who owns the brand Ebglyss, and he said that we're going to try to get you through this trial and see if we can get it done, because it's a very, very, very expensive medication, apparently. I'm not sure how much it is, but I did get approved. It took a little bit of time to get that approval. Through that phase, I was also reducing the amount of topical steroid I was using, because topical steroids, a lot of people don't know, but there's actually a syndrome called topical steroid withdrawal. So when you go through withdrawal, your skin goes through a major transition and flare up where it flakes right off and it oozes. And it sounds so gross, but a lot of people do this transformation so they can get off the reliance that they have on topical steroids. Topical steroids can screw up a lot of your systems in your body, and the long-term stuff with using topical steroids is just not good. So a lot of people try to get off of these things, and including myself. I didn't want to use it anymore. I was trying holistic methods, trying to have less symptoms, and as much as I wanted it to work and as much as it worked for other people, my case is just super severe, like throughout my body, always constantly on fire. So I can't wait to see the results that I'm going to have from using this new type of medication. Anyway, let's get back to the unboxing. All right, here's the box. It comes in a temp aid sort of refrigerated cooler. And if you don't know, the medication is a injectable. So what I've heard about these injectables or biologics is that they also treat inflammation. And being as I do have atopic dermatitis, which is, of course, eczema, I also suffer from having asthma, which is also a type of inflammation. So I guess this is the packing slip, which is, it shows that I have the Ebglyss 250 pen. There's some information there. There's 4. It shows that I have 4. Again, it's a refrigerated box packed with some temp aid gel packs to keep things cold. So there we go. Oh, okay, another layer of this cool stuff. And there's the Eblyss pens. This is gonna change my life, hopefully, folks. These guys here, Eblyss. This is a pen that has 250 milligrams or 2 milliliters. And where it says for subcutaneous use only, that means it's used as an injection. It's like a pen. If you're diabetic like me, you understand, because you've used insulin before, or you've used the most popular drug right now, Ozempic, which is something that I'm on as well. Next thing is we're gonna open this. There it is. It's open. And just like any other injectable, there's some instructions there on how to do it, and instructions there on dosage. There's the pen itself. Now, you don't want to inject this cold into your body. You got to let it get to room temperature for about 45 minutes before you do that. Now, something I want to bring up when it comes to atopic dermatitis is that sometimes you get hospitalizations. When I was a child, I was hospitalized for having extreme eczema. Everything was bleeding and oozing and just hurt. So they put me on medications like prednisone. To a lot of people, could be like a miracle drug where it cures it all. It cures that inflammation. It clears up the skin immediately upon the first dose, and even kind of makes you feel like you're clear of all your symptoms of having eczema and atopic dermatitis, as well as your asthma. The only thing is, when I was a developing boy, is that when I was put on such high dosages of prednisone, it made my face round. It gave me a humpback. It gave me, I guess, a lot of extra, what they call a moon face. And it changed the way that I grew. And I grew up to be a bit, I guess you can call it deformed. I hate thinking about that because it's attached to some real trauma that I had growing up in my self-image. affects me to this day. Honestly, it does. As much as that medication helped me through those times and I got better, as recently as about a month ago, I got hospitalized for pneumonia. I thought I just had a serious fever and was just going through it, not able to sleep. So, of course, they prescribed prednisone, which gets me cleared up right away, and I was feeling a lot better. But the thing was, the doctor that prescribed that, or actually was going to discharge me, had not give me a schedule for tapering the drug off. When that happens, to me at least, when you factor in the fact that I didn't have any sleep for about 60 hours, and then on top of that, I'm on a medication that changes your mood, I went through a bout of delirium. Now, if you don't know what delirium is, it's like you're going crazy. It's like I thought I was in a simulation that I had to break out when I was in a hospital, and I actually acquired some weapons, and there was enough sense in me to talk it out with people, especially my girlfriend at the time, and I was able to talk to the discharging team of the hospital and say, I'm not in a good space. I need to be held on a Form 1 because my mind wasn't there. So that's my experience with prednisone. It's not always like that with that medication, but I did notice, and especially my parents can attest to this, when I was growing up as a teenager on prednisone, my teenage angst combined with that got me into some trouble with some of my temper issues, and also just kind of like when you're on that medication, you feel strong. I felt strong about my feelings, and I also felt confident that I was actually clear of my atopic dermatitis and the things that held me back, including my asthma. But what I didn't know is the damage that it was doing to the other parts of me, including my liver, as well as including my sort of integration into society. I was kind of, having issues with that. But here we are. We are in a new phase. I can't wait to try this new medication. It is a biologic medication from Lilly. It's called Ebglyss. The medical term for it is Lebrikzumab. And we're going to go through some more of this unboxing and some details because I think it's only been out for a few months. So I look forward to going through this journey and filling you in on how it's going. I'm going over the patient medication information. Obviously here, read carefully the instructions before you use this or each time you refill. It's a summary. It's a quick summary. And you should talk to your pharmacist or healthcare professional about it. Ebglyss is a prescription medication used to treat adults and adolescents of 12 years of age and older who weigh at least 40 kilograms with moderate to severe atopic dermatitis, aka eczema, that is not well controlled with prescription therapies used on the skin. It is not known if Ebglyss is safe and effective in adolescents with atopic dermatitis who weigh less than 40 kilograms or children under 12 years of age. Lebrikzumab is a monoclonal antibody. So monoclonal antibodies are a type of specialized protein that recognizes and binds specifically to certain proteins in the body. It works by blocking protein called IL-13, which is found in higher amounts in people with atopic dermatitis. This can result in reduced inflammation, improved condition of skin, and reduced itch, redness, and scaling. Man, I'm so stoked for that. It goes over what's in the actual injection here, the two different forms that it comes in. Do not use this if you're allergic. You obviously do not know or cannot know that if you're allergic or not. I guess the best advice there is to let people know that you're trying a new medication or try to be around people so that they can monitor you. Obviously today I'm just alone. Called my dad today to see if he can check up on me. The other recommendation is for you to have a talk with your medical healthcare professional before taking this, but also if you have issues like eye problems like itching and redness, infection, or you know what, you can't also take vaccines at the same time when you're being treated with Eblyss. Obviously a big problem for me is that pregnancy. I am pregnant at this time. No, I'm kidding. I'm not pregnant. But, it's not known yet if it's going to affect a baby. Breastfeeding, obviously the same thing. It's not known if the medication passes through the breast milk. So they tell you to talk to your healthcare professional about what medications you take. And it says here, the following may interact with Ebglyss. And there's nothing there. So they did ask me upon intake what medications I was on, just to make sure none of it would interfere with this medication. Okay, so how to take it. It says basically use it as prescribed by your professional. It comes in a single-use pre-filled pen with a needle shield. Do not try to inject Eblyss until you have been shown the right way by your healthcare professional. you can inject it into your abdomen or your thigh, or someone can do it in the back of your upper arm, which I've had before when it comes to taking insulin. Your healthcare professional may prescribe other medications to use with this. Do whatever they say, and do not use this medication if it looks cloudy or is leaking. The usual dose, so this is very important, guys. The usual pre-filled dose, each pre-filled pen and pre-filled syringe with needle shield contains 250 milligrams of Eblyss to be injected under the skin. The initial dose is 500 milligrams, so 2 injections at week 0 and week 2, followed by 250, 1 injection every 2 weeks until week 16. The maintenance dose is 250 milligrams every 4 weeks starting at week 16. Overdose, if you think someone has taken too much, obviously it tells you to get them to emergency. And then quickly here, how to report your side effects. Again, the storage information. And if you want more information about Eblyss, you can talk to your healthcare professional. Find the full product monograph on that website there through Health Canada. And of course, the trademark and information about the company there. This is the instructions for the use of the Eblyss pen. The top has the purple injection button. This is the lock ring, so you can twist this part in order to keep it in the lock position, or when you're ready to inject, you put in the unlock position. This is the dial indicator right here. You twist it to the unlock position once you're positioned where you want to inject. In here, you can see if the medicine is clear. If it's clear, it's good to go. If it's cloudy, if it's discolored or yellowed, don't use it or put it in your body. The needle is stashed in there, as well as the base. There is the cap at the bottom that holds it up in place like that. And what they tell you is to prepare your supplies. So make sure you got your pen out of the refrigerator, your alcohol wipe, your cotton ball or piece of gauze in case you start to bleed afterwards. And of course, you got to dispose of this in a sharps disposal container. Obviously, do not microwave it or put it in hot water or direct sunlight. And don't use it if it is frozen. Obviously, freezing crystallizes liquids and causes a chain reaction to the chemicals. Anyways, here it tells you to inspect the pen and the medicine. Make sure the pen isn't damaged and the medicine isn't cloudy or discolored or has particles in it. Air bubbles is normal from what I understand. The expiration date is printed on the label, and if it has passed, do not use it. Typical with any sort of injection care, make sure your hands are clean. Make sure the site that you're injecting is clean as well. Approved places to use is your stomach area, your front of your thigh, or your back of your upper arm, where you need help to do the back of your upper arm to do proper. Don't always use the exact same spot every time, and don't use it where the skin is tender, bruised, red, hard, or an area of skin that is affected by atopic dermatitis or other skin lesions. For a guy like me that has atopic dermatitis, I'm running out of places where there isn't any atopic dermatitis, so I am glad that I'm getting on this medication now. Now we're getting into the how to uncap it. Obviously, you want to make sure that the pen is locked. If it's not locked and you accidentally hit that trigger, you would have wasted your dose. Make sure that position right here on this thing is locked. It's locked just like that. Don't put the gray base cap back on once you have already taken it out, because it activates the needle and the needle is ready to deploy into your body. And then when you place it, you want to unlock it, and then you make sure that the lock ring is in the unlock position, ready to deploy into your body. You hold it up against your skin. In this image, it is being held up against the abdomen. And then you press and you hold it, and just like a lot of people that are diabetic, they understand how this works. You hear the first click where it is the plunger pushing down on the medication to go into your body. And then once you hear the second click, the injection is completed. I've always been told to keep it in there for another couple extra seconds to make sure all of the medication is deployed. And it says you will know the injection is complete when the gray plunger is visible, like so. When you're disposing of the Ebglyss pen, and also there is very specific instructions, especially depends on where you live and local laws on how to throw away your needles and pens. The best way is to keep it in the sharps container and then follow your local instructions on how to dispose of that sharps container. On the back of this, I guess, instruction booklet is also commonly or frequently asked questions. Like for example, what if you see bubbles in the pen? Air bubbles are normal. What if there's a drop of liquid on the top of the needle, which is normal for any sort of injection? What if I unlock the pen and press the purple injection button before twisting off the base cap? Oh boy, do not remove the base cap. Basically, it's a throwaway, so do not make that mistake. Do I need to hold the purple injection button down until the injection is complete? You don't need to hold the purple injection down, but it may help you keep the pen steady and firm against your skin. So just like the other injectables, if you're a diabetic, you can hold down the button. If you don't need to, you don't need to, but it's suggested so that you have stability with the needle. What if the needle did not retract after the injection? Don't touch the needle or replace the gray base cap. So put it in a safe place so that nobody gets a needle stick, and then call Lilly at that 1-800 number for instructions on how to return the pen. And then what if there's a drop of liquid or blood on my skin after injection? Just basically it's normal. And how can I tell if my injection is complete? You'll hear the 2 loud clicks and your injection is complete, and the plunger would have gone all the way to the base. It may take up to 15 seconds. That's why they tell you to take the medication out of the fridge, because I find the viscosity of certain things are thicker when it comes to them being refrigerated. Just like oil. Like when you start your car in the winter time, the oil has to warm up in order for you to drive safely before driving, because what ends up happening is that you end up damaging the engine because it's not getting the oil that it needs, and the oil's not getting where it needs to go. What if you remove the pen before the second click? I guess you would have made a mistake and you would not get your full dosage. And what if I heard more than 2 clicks, which is pretty normal, sometimes that happens. Again, it goes through storage instructions about your pen. Don't freeze it. Obviously, you store it in the original carton to protect it from light. Do not microwave it. Do not shake the pen. Throw away pen if the above conditions are not followed, and keep your pen and all medicines out of reach and sight of children. Very important. This is very dangerous stuff when it comes to kids. All right, here we go. I know if you're a bit squeamish, please don't watch this. Again, it's in a lock position. The cap is still on. I'm going to take the cap off and go ahead with this. All right, here it goes. 1/2 of the initial dose of 250 or 500 milligrams altogether for the first initial dose. It's prepped. I've unlocked it, as you can see, and it's time to press the button. 1, 2, 3, 4, 5, 7, 8, 9, 10, 12, 13, 14, 15. And the 2-second click had gone off, meaning the administered dosage has gone through my thigh. That's number 1. And there is a bit of a bump amongst the other bumps I have, a little bit of a bump and a little bit of blood. And I will clean that up and set up for the second one. As you can see, the plunger has deployed all the way in, and that's 1/2 of the dosage. Now for the second dose, I actually decided to go into my abdomen instead. So here we are, we're going to unlock it. This is going to hurt like a MFer, but whatever. I've already alcohol swabbed the area, and we're ready to go. Fully administered and ready. It doesn't actually hurt that bad. Maybe you have a little more meat around the middle section. Okay, so obviously it's not going to take efficacy. It's not going to work right away. I don't expect any results for the next little while. Through the limited information online, it seems like it takes maybe like 10 days or 2 weeks to see any sort of results that are significant. I'm hoping that this is the answer to all my prayers and to all my wishes. I hope this helps others out there. I'm going to continue to report my findings. As you can see, I do suffer from severe atopic dermatitis. Hopefully, this is it. I hope this is gonna, most effective way to treat my condition. And I hope this helps others. This is why I'm doing this. This isn't exactly my plan to do videos like this, but, I've always been a compassionate person. If anything, this sort of thing growing up. Having this condition helped me to have empathy for others, and I hope that it is the answer for millions of people that are suffering from atopic dermatitis slash eczema. And for the meantime, I'll keep you guys posted. If you want to follow me on my socials, I don't really post anything about this stuff on my socials, but if you're interested in getting to know me a little better, and maybe I'll post on there a little bit about what I'm doing when it comes to my treatment using Ebglyss on my socials. If you want to find me on Instagram, it's at Jover. That's at Jover. And also, don't forget to like and subscribe to this channel, tracking the results of using Eblyss. And we'll check in every once in a while. Hopefully things work out. Hopefully the next time I post a video, I am feeling better and I'm looking better. All right? Talk to you soon. Bye. Honestly, I feel like it's a normal day so far. No adverse reactions or anything like that. I don't feel drowsy or feel like there's any cognitive changes. Everything's been fine so far. Fingers crossed that everything's going to be good. I'm going to be reporting every once in a while in periodic times and let you know how things are progressing. If anything, one thing I've noticed is today I'm not as itchy. So maybe it's already working. First day so far. It's been pretty good. Until then, please like and subscribe. Follow along on this journey. Hopefully, we got some good things to report in the next little while, the next couple of months. And hopefully, please leave some comments. Please let me know how it's going. If you're also doing this, please let me know how it's going. And if you're just curious, man, just send me a message, leave a comment, like and subscribe. Thank you very much. My name is Jover. See you soon.